A 34 years old man from the Zimbabwe admitted with abdominal pain in the emergency department. An abdominal X-ray reveals urinary bladder calcification. What is the most likely diagnosis? So here we can see a patient, 34 years old man from the Zimbabwe, suddenly present abdominal pain and present with in the hospital, and abdominal X-ray shows there is a urinary bladder calcification. That means the stone within the urinary bladder. But now we have to find out which organism may cause this urinary bladder calcification. Here the options are Schistosoma manushi, sarcoidosis, leishmaniasis, tuberculosis, and Schistosoma hematobium. So which of the following organism is responsible for the calcification? Actually, first of all, there is a malignancy developed, and at the malignancy calcium deposition occurs. That means the stone present in the urinary bladder by the infection. First of all, there is a carcinoma or tumor, and after that there is calcification within this tumor or cancer. So let's see this schistosomiasis. This schistosomiasis or bilharzia is a parasitic flatworm infection, and the Schistosomia manushi and Schistosoma, the intercalatum, they are the intestinal schistosomiasis, and Schistosoma hematobium, it is the urinary bladder schistosomiasis. So there are three important schistosomiasis. One of them is the hematobium, which is responsible for urinary bladder schistosomiasis. On the other hand, the manushi and the intercalatum, they are the intestinal schistosomiasis. And Schistosoma hematobium, it is very important, because here we can see the Schistosoma hematobium, it is present in the swimmer's yeast. That means usually the patient who have recently returned from the Africa, and our patient here we can see from the Zimbabwe, which is one of the country of the Africa. So in the Africa, it is very common, the Schistosoma hematobium, they present in the water, and when the patient baths in the pond, in this condition, the Schistosoma hematobium organism, it enters in the urinary bladder. And the Schistosoma hematobium is a risk factor for a squamous cell carcinoma of the bladder. So in case of the bladder, there are different type of the carcinoma. One of them is the squamous cell carcinoma. Other carcinoma such as the transitional cell carcinoma, adenocarcinoma, and finally the squamous cell carcinoma. And this squamous cell carcinoma, it is caused by the Schistosoma hematobium. And transitional cell carcinoma of the bladder, it is the most common type of bladder tumor. Also adenocarcinoma may occur in case of the bladder, but in case of the infection, usually it is by squamous cell carcinoma, and within this squamous cell carcinoma, usually stone deposition occurs. So here we can see the features of the schistosomiasis. Let's see the features. First of all, the frequency, hematuria, and bladder calcification. So the calcification, usually it is a feature for schistosomia, but other clinical features such as the frequency and hematuria also present. And what are the management? The management for schistosomiasis is a single oral dose of praziquantel. Schistosoma hematobium, it causes the hematuria, that means presence of blood in the urine. Schistosomiasis is the most common cause of the bladder calcification worldwide. So bladder calcification by infection, it is usually caused by the Schistosoma hematobium. Schistosoma manushi typically resident in the colon and from it excreted. And other two schistosomas such as the Schistosoma manushi and the Schistosoma intercalatum, they present within the gastrointestinal tract and causes symptom there. So what is our answer? And that from Zimbabwe, that means Africa, then present abdominal X-ray reveal urinary bladder calcification and abdominal pain. So from Zimbabwe, which is Africa, abdominal pain, then abdominal X-ray presents urinary bladder calcification. These three are in favor of Schistosoma hematobium. Other options here such as Schistosoma manushi, they present in case of the gastrointestinal tract. Sarcoidosis, the sarcoidosis is autoimmune disease, and usually it affects the different type of the gland. Leishmaniasis, the clinical feature of leishmaniasis is the bilateral enlargement of the leg. And tuberculosis, it causes the hematuria, but usually not associated with the urinary bladder calcification. Thank you.